Open coil may be used in the level alignment stage in the anterior segment on 016 nai-tai wire. Do not use open coil in the posterior segment on 016 nai-tai since the chewing forces will cause tipping problems. The open coil is cut 2 to 3 millimeters larger than the inner bracket space. Clinically, estimate the amount of extra as the width of the adjacent bracket. Be sure to tie in each bracket with steel ties to prevent rotations of the tied-in teeth. This technique is very effective for making space for blocked out or severely rotated teeth. At successive months of treatment, you may consider tying in the bracket of the blocked out tooth to the center of the coil to deflect the nai-tai wire. There is no specific tie-in technique for attaching the ligature wire to the bracket. Be sure, however, to tie the tooth to the center of the coil in between the brackets. This procedure will allow you to get the coil out of the patient's lips, making it more comfortable. As well as applying some force to the lingually placed tooth by the nai-tai wire deflection. When using the long-ended preformed ligature wire, wrap all the ends together before cutting. This will help in cleanup. We refer to this procedure as packing coil.